Hello, everybody, and thank you for joining the December Kapnick Strive webinar. It's our last webinar of the year, but we are so glad that you're here. Now, you might be tired of feeling cold this winter, particularly if you live in Michigan. I know it's been pretty chilly the past few weeks, but in today's webinar, we're going to be covering how the cold can be used for health benefits. So without further ado, let's jump right in. Now, before we jump right in, a really quick but important note. So today's presentation is for educational purposes only. We're exploring how cryotherapy is used and what research suggests about its potential benefits, but this is not medical advice. Cryotherapy isn't appropriate for everyone, and individual health conditions matter. So always consult with a qualified healthcare professional before trying any new treatment, especially one involving extreme temperatures. So think of today as a learning opportunity, information that you can use to make informed and safe decisions. So what is cryotherapy? At its core, cryotherapy simply means cold therapy. The word comes from the Greek kryos, meaning cold. So cryotherapy involves exposing the body or a targeted area of the body to very cold temperatures for a short period of time to create specific physiological responses. This can range from something as familiar as an ice pack to something more advanced, approaches like whole body cryotherapy chambers. The goal is never discomfort. It's to trigger the body's natural healing and adaptive responses. So in the rest of this webinar, we're going to be covering all things cold, talking about polar plunges, cryo chambers, the research behind the practice, why it works and why it might not, and the potential risks and more. So taking a quick look at the history of cryotherapy. Cryotherapy, or cold therapy, isn't new. In fact, it's been used for thousands of years. Ancient Egyptians used cold water baths for pain relief, and Hippocrates wrote about ice and cold water as a treatment to reduce swelling and inflammation back in the 4th century. The Egyptians, Greeks, and Romans weren't alone. In the early 1800s, during the Napoleonic Wars, the Grand Army Surgeon noted the use of ice and snow for pain management during amputations and surgeries. Fast forward to the 1970s, when modern cryotherapy techniques began emerging in Japan for treating inflammatory conditions. More recently, athletes, especially early adopters like football and rugby players, really adopted the whole body cryotherapy technique for exercise recovery. Today, cryotherapy has expanded well beyond clinical settings and is used in sports, dermatology, pain management, and wellness environments around the world. So like we said, cryotherapy is kind of everywhere now. And today, cryotherapy shows up in many different forms. It's not just snow and ice anymore. So you might see it in physical therapy clinics, sport recovery centers, dermatology offices, or wellness studios or health spas. You may even see influencers or celebrities taking ice baths or joining polar plunge social groups. So let's take a look at some common cryotherapy methods, starting with ice pack therapy. This includes applying ice packs, whether they be crushed, cubed, or gel, or in my experience, maybe a bag of frozen peas, to a specific spot for pain and inflammation. Now, most of us have done this at some point in our life. Ice pack therapy is incredibly common in home care and in basic sports medicine. Next is cold water immersion. This is simply when the body is submerged in cold water, like ice baths, or in natural sources like lakes or ponds. This method has become increasingly popular for post-exercise muscle recovery. Whole body cryotherapy is what you might find in wellness studios or health spas. This method includes standing in a cryo chamber for 2 to 4 minutes, exposed to extremely cold, dry air. And when I say extremely cold, we're talking negative 180 to negative 274 degrees Fahrenheit. This brief, very brief time in the cryo chamber is intended to trigger systemic anti-inflammatory responses. Next is localized or partial body cryotherapy. This uses the same technology as whole body cryotherapy, but focuses on using controlled streams of cold air, often nitrogen vapor, on specific areas like faces or sore muscles for targeted relief. So it's kind of like combining the effects of whole body and ice pack therapies. And then lastly is medical or surgical cryotherapy, which is also known as cryosurgery. This method uses a tool called a cryoprobe to deliver extreme cold, again, liquid nitrogen or CO2, directly to abnormal or cancerous tissue inside the body, freezing and destroying it. But there's also over-the-counter tools that use a similar method, like treatment kits that use freezing to remove warts. It's obvious that all of these methods and the growing popularity of cryotherapy reflects a broader interest in recovery, performance, and proactive health rather than just treating illness. How does it work? So what is actually happening when your body is exposed to extreme cold? What's the science behind the practice? So think about a time where you have been in extreme cold, what you consider to be extreme cold. Maybe it's an icy shower or swim or stepping outside on a blustery winter day. Think about how your body reacts. You might tense up, your breathing might change, you may begin to shiver, or your teeth might start chattering. This is because being cold, particularly experiencing sudden extreme cold, can cause a stress response. So, in response to extreme cold, the body performs a kind of emergency reaction to speed up blood flow to the core to maintain optimal body temperature. This To speed up the blood flow, the blood vessels constrict, and this constriction leads to a reduction in inflammation and swelling. This reaction also activates the sympathetic nervous system, changing hormone and neurotransmitter levels. After leaving the cold environment, returning back to a warm area, your blood starts to flow back to the limbs and those other peripheral areas. So when this happens, the blood flow brings a rich supply of resources like oxygen and nutrients prepared by the body to combat that emergency situation. Now, these resources, the oxygen, the nutrients, then aid with muscle recovery. Cryotherapy can also influence nerve signaling, which may temporarily reduce pain, and it may stimulate the release of endorphins, which are our body's natural feel-good chemicals. It's essentially a controlled stressor that encourages the body to respond and recover. This process is also a part of why you might feel so tired after coming in from a chilly outing. Your body has to spend more energy to maintain its core temperature when it's cold than it would in more balmy weather. Just like there are a number of methods to use cryotherapy, there are also many reasons to use it. So it's important to note that cryotherapy research is still in its infancy, even for how old it is, particularly in relation to specific diseases and conditions. There are, however, some proven treatments and research-supported applications. So your provider might recommend cryotherapy, like cryosurgery or cryoablation, for conditions like bone cancer, cervical cancer, liver or prostate cancer, having precancerous cells in the cervix, precancerous skin conditions, and most commonly, cryotherapy may be recommended for skin conditions like warts, skin tags, or dark spots. Outside of removing targeted tissues, cryotherapy has been used in sports medicine, mental health treatment, and also with some success in the treatment of inflammatory conditions. So we'll cover each of these applications in a little more depth in the following slides. Now, in dermatology, cryotherapy has a long established role. Dermatologists often use controlled cold, usually liquid nitrogen, to treat conditions, again, like warts, precancerous lesions, and benign skin growths. In wellness and aesthetic settings, cold therapy is also explored for reducing puffiness, tightening skin, and calming inflammation. And this is thought to aid in acne, eczema, or psoriasis-associated inflammation. It's thought to help reduce pore size and brighten complexion. Now, this can be done a number of ways. There are cryofacials, which spray vaporized nitrogen around the face and neck to tighten skin and stimulate collagen production. And there's also been a growing trend of keeping facial tools and skincare products cold. So putting facial rollers, massagers, or masks in the freezer for a refreshing and stimulating experience, or keeping skincare products in the fridge to both extend longevity and shelf life, but while also providing a soothing sensation. Now, these cosmetic uses are different from medical dermatology, but they highlight how cold can influence skin health and appearance. Now, next is talking about athletic recovery. Athletes were among the earliest adopters of modern cryotherapy. So after intense physical activity, muscles experience micro damage and inflammation. They've been working hard and they've been straining. But cold exposure may help reduce soreness, support recovery, and improve how athletes feel between training sessions. While cryotherapy doesn't replace rest, nutrition, or proper training, many athletes see it as a tool to help them recover more efficiently and get back to activity feeling refreshed. On top of this, cryotherapy may boost the body's antioxidant response and exercise capacity. So, early studies of whole body cryotherapy concluded that it's generally safe, doesn't, doesn't negatively affect cardiac or immune health. And it's important to note, however, a 2017 literature review found that the cooling effectiveness depends on the percentage of fat mass of an individual and their starting fitness level. So, cryotherapy may be more effective for some individuals than for others. And again, this is why it's so important to talk to your healthcare provider for a personalized recommendation. All right, let's talk about pain management. So, almost all of us have used cold therapy because cold therapy is the I part of RICE, right? Which stands for rest, ice, compression, and elevation. And if you've ever been injured, this routine should sound familiar. This is a treatment recommended for the home care of many injuries, and it is often a suggestion for sports injuries. Now, cold therapy for pain relief may be used for things like runner's knee, tendinitis, sprains, pain after a joint replacement, arthritis pain, low back pain. There's all kinds of different uses. Now, looking at some specific conditions, for arthritis, several studies found that whole body cryotherapy helped decrease pain related specifically to rheumatoid arthritis. Another study found that cryotherapy improved mobility and reduced the intensity of pain in people with rheumatoid arthritis, and that the positive effect lasted at least 3 months afterward. Several studies also recorded a measurable decrease in specific inflammatory markers after the therapy, showing that the improvement wasn't just based on the perception of the participant, but was backed by the body's changing biology. Now, less research has been done on cryotherapy for multiple sclerosis, but one small study found that it had some measurable antioxidant benefits, which are helpful in fighting neurodegenerative diseases. Another small study found whole body cryotherapy to be effective for treating chronic low back pain. So cryotherapy decreased, again, measurable inflammatory markers and boosted those anti-inflammatory markers. It's important to note that different methods of cryotherapy have different levels of effectiveness depending on the condition or disease. So, a lot more research is needed before general conclusions can be drawn. Again, talk to your doctor if you're interested in exploring cryotherapy for pain management. Now, beyond injury or pain, some people turn to cryotherapy for overall wellness. Users often describe feeling energized, mentally clear, or uplifted afterward, likely due to endorphin release and nervous system activation. So, while research on wellness outcomes is still developing, cryotherapy fits into a growing interest, again, in resilience, in recovery, and stress adaptation. The key is approaching it mindfully rather than viewing it as a quick fix. So, a recent systematic review found that cryotherapy may lower levels of cholesterol and triglycerides. And even more, a very recent study incorporated whole body cryotherapy into a more traditional treatment plan for people with obesity who also experienced various post COVID conditions, such as pain, poor sleep, muscle fatigue. So, in addition to exercising and eating a healthy diet, study participants went through cryotherapy. After 4 weeks, participants lost weight, became leaner, and had lower cholesterol and inflammation markers than at the beginning of the study. Now, whether that is due to cryotherapy or the emphasis on exercise and healthy diet has yet to be determined. Additionally, preliminary evidence suggests that whole body cryotherapy may be useful as an add on intervention for mental health problems, especially for symptoms of depression. Research has also found that cryotherapy may enhance quality of sleep and help decrease tiredness. This is all to say there's a lot of early research looking at how cryotherapy can support well-being in a number of different ways. However, more research is needed. In the meantime, and before we start to think of cryotherapy as a cure-all, it's important to explore the risks. Now, this is an extremely important point. Cryotherapy is not appropriate for everyone. People with certain conditions, such as uncontrolled high blood pressure, heart disease, Raynaud's disease, nerve disorders, or cold sensitivities, may be at higher risk of negative health effects or injury. Pregnancy and certain medications may also be considerations. Notably, humans have a much lower capacity to adapt to prolonged exposure to cold compared with prolonged exposure to heat. So even if cryotherapy sessions are very short, they still may be too extreme for some people. Acute exposure to a cold environment, either air or water, like we said, causes a stress reaction as well as a temporary jump in blood pressure. That's because the cold causes the blood vessels to temporarily constrict, which in turn results in higher pressure. There also may be other negative effects that aren't known yet, because remember, more research is needed. That's why medical clearance and honest health screening are essential before trying cryotherapy. Talk to your doctor or healthcare provider before trying any form of cryotherapy. Like I said in the last slide, cryotherapy is not without its risks. So these include skin issues like frostbite, burns, redness, and blistering, plus potential nerve damage, scarring, or even color changes in the skin, with more serious internal risks like heart and circulatory problems possible in vulnerable individuals. Additionally, outdoor cryotherapy methods like polar plunges come with additional risks like shock, drowning, exposure, and even death. We cannot emphasize this enough. Talk to your healthcare provider about cryotherapy and practice extreme caution. So while extreme cold has the potential to be beneficial in small doses, it's easy to overdo and cause injury. Now, you may have heard of this guy, Wim Hof. He's an extreme athlete and motivational speaker who is well known for his ability to withstand extremely low temperatures and perform athletic feats. So, for example, he holds a record for running a half marathon barefoot in snow and ice. He attributes his feats to what he calls the Wim Hof method, which uses a combination of frequent cold exposure, breathing techniques, and meditation to withstand the freezing settings. Now, as a motivational speaker, he gained a lot of popularity in the wellness circuit, with many people trying the Wim Hof method. As of March 2024, there are 32 reports of people dying allegedly due to the Wim Hof method, almost all of them from drowning. Nearly 20 other adverse events have been reported that are associated with the Wim Hof method, including non-fatal drownings, cardiac arrest, seizure, and loss of consciousness. Polar plunges, especially those in natural bodies of water or deep bodies of water, like ponds, lakes, and rivers, come with great risks. The primary danger is cold shock response, which happens immediately upon entering the water. This triggers several involuntary and potentially dangerous physiological reactions. First, you experience that vasoconstriction, which forces the heart to work much harder. This can be problematic for those with heart disease, high blood pressure, or irregular heartbeats, and in some cases can cause a heart attack. The initial shock can also cause an uncontrollable gasp for air and rapid breathing. If the head is underwater during this reflex, it can lead to inhaling water and drowning, even in shallow water. And remember what happens during vasoconstriction? All of that blood rushes to the vital organs. It rushes to the core to preserve core temperature. This can cause numbness and loss of strength and coordination in the arms and legs. And this makes it difficult to swim or pull oneself out of the water. So while cold water immersion therapy may have some benefits, it's important to take precautions and not to copy the pros. So for all cryotherapy, it's essential to talk to your healthcare provider prior. Even if you're cleared by your provider, there are still measures to consider. The type of cryotherapy determines the safety precautions to take. So first, if you're visiting a wellness facility or a health spa, ensure that the facility is reputable and offers proper supervision, limits exposure time, and be sure to follow all instructions carefully. For whole body cryotherapy, these are the steps you can take. So ensuring that your skin is completely dry because moisture can lead to frostbite, taking off all metal jewelry, wearing minimal clothing, but protective gear like gloves, socks, and any masks that are provided, avoiding applying lotions, makeup, or powders, and never falling asleep during a session. For outdoor cold water immersion therapy, there are more precautions to take. So never plunge alone. Use the buddy system. Ensure someone is watching you who can assist or call for help if needed. Never plunge in an ice-covered river. So the ice may make a river seem very serene and peaceful, but there is still a current moving under the surface that can and will carry you away. Avoid jumping or diving headfirst to reduce the severity of the cold shock response. It's recommended to wade in gradually and help your body acclimate. Limit your time in the water to a few minutes at most. This goes for ice baths too. The most dangerous time for a polar plunge or for cold water immersion is in the first minute. Always keep your head above water. This helps prevent the accidental inhalation of water during that initial gasp reflex. Don't drink alcohol before doing a plunge, as it can impair judgment and affect your body's ability to regulate temperature. Have dry towels, warm blankets, dry clothes ready to put on immediately after getting out. And of course, then dry off and warm up the dry clothes in a warm, non-alcoholic beverage. So for all cryotherapy, all types, if it hurts or feels wrong, stop. Cryotherapy should feel invigorating and not painful or unsafe. Now, cryotherapy works best when viewed as one tool, not the tool. So true well-being is built on consistent foundations: quality sleep, balanced nutrition, regular movement, stress management, and social connection. Cold therapy may complement these habits, but it can't replace them. So when aligned with healthy lifestyle choices, cryotherapy may support recovery and resilience, but it's just one piece of a much bigger picture. But cold weather doesn't mean movement has to stop. So outside of cryotherapy, let's talk a little bit about cold weather and how we can still still support our health even when it's cold outside. So winter does offer some unique and fun ways to stay active, whether you love the outdoors or prefer to stay warm inside. So let's start outside. Walking or snowshoeing are some of the most accessible winter activities. Snowshoeing in particular adds strength and cardio element while also being really gentle on the joints. But even a brisk winter walk can boost circulation, improve mood, and provide a mental reset. Just dress in layers and wear shoes with good traction. For those who enjoy speed and adventure, skiing, whether downhill or cross country, offers a full body workout. It builds balance, coordination, and endurance while getting you outside in fresh air and natural light, which can be especially helpful during shorter winter days. Ice skating is another great option. It challenges balance, strengthens the legs and core, and improves coordination, all while feeling more like play than exercise, and even short sessions can be surprisingly effective. And if you do end up spraining an ankle while on ice skates, you can use ice pack therapy to help that swelling and inflammation go down. And don't underestimate the power of sledding and snowball fights. So these playful activities still count as movement. So running uphill, squatting, throwing, laughing, all that contributes to physical activity and also stress relief. Movement doesn't have to be structured to be beneficial. It can just be having fun. Of course, winter movement doesn't have to happen outdoors either. So indoor options like stretching, yoga, bodyweight exercises, dance, or short movement breaks throughout the day can keep you active when the weather doesn't cooperate, and even a few minutes at a time adds up. Just remember, the goal is simple. Keep your body moving in ways that feel enjoyable and sustainable. Winter can be a season of movement. It just invites us to get a little more creative. Now, if you'd like to learn more about cryotherapy or using cold, I recommend checking out the Stuff You Should Know podcast. They have an episode that covers whole body cryotherapy, looking at the origins and its infiltration into medical spas and gym locker rooms. So they talk about the effectiveness and cover the research and the limitations. So you can scan the QR code, check that out. Then from the National Center on Health, Physical Activity, and Disability, you can discover a quick and effective exercise to reduce anxiety and get some guidance from therapist Krista McCrory. So she introduces in this video techniques that involve ice or cold exposure to activate the vagus nerve or the vagus nerve, a key player in managing the body's stress response. So simple practices like using ice packs or taking cold showers can help to lower your heart rate and soothe your nervous system. So check out those resources. And that's all that we have for you today. Thank you for joining our very last webinar in 2025, and we look forward to seeing you at our first webinar in 2026 on January 28th. We're going to be talking about nicotine beyond the cigarettes. So we'll be covering not only cigarettes, but vapes, nicotine pouches, snuff chew, everything that's out there, what it looks like, the potential risks, and more. So to register, you can visit the Strive library or scan the QR code. Thanks again. I'll stay on for just a minute in case anyone has any questions they'd like to ask in the Q&A or in the chat. But once again, thank you for joining, and I'll see you in 2026.